I'm Dr. Peter Leo. I'm a board-certified dermatologist in Chicago, and my area of focus is eczema. I run the Chicago Integrative Eczema Center. I'm a board member for the National Eczema Association, as well as a scientific advisory committee member, and I'm a proud advisor for GladSkin. Historically, the thinking was that the microbiome really is a reflection of what's going on inside, so that if the skin was in good shape, the microbiome should be in good shape. But I would argue that this is changing, that now we're understanding more than ever that the microbiome is not the cart being pulled by the horse. It may actually be the horse in some situations, meaning what happens there first can then directly impact both the immune system and the skin barrier. There is a model put forth by Dr. Heidi Kong at the National Institutes for Health a few years ago where she actually described it as being a microbiome imbalance as the driving factor for an eczema flare, and that the flare wouldn't actually get better until the microbiome healed first. Balance was restored, then the eczema healed. So that is incredibly compelling, and I think more than ever we're realizing that this can be a predominantly or primarily bacterial-driven disease in some patients. It's hard to speak for all of them, but it seems like many patients this could be something that's going on as a primary cause. Historically, people would talk about Staphylococcus aureus as being a colonizer, an opportunistic infection in the setting of damaged skin barrier of eczema. And that's how I learned it, that you have broken skin, people are scratching and rubbing, and staph is now growing out of control. We were even taught that you didn't have to treat it at all unless it became a true clinical infection. Obviously, if they have a true infection, then we want to go ahead and treat it appropriately. But for those patients that were just colonized, you didn't have to worry about it. But that is all being turned on its head. Now we understand more than ever that it is not just a symptom of the eczema. It actually is probably a driver of the disease for many patients. And it does that through a number of mechanisms. Part of it seems to be that it's fueling the immune response directly. Part of it is through some of the toxins that it's making, damaging barrier and fueling the immune response. So if we had a way to address staph without disinfecting the skin and damaging the microbiome, without using antibiotics that are going to continue to contribute to resistance in the community and potentially have other untoward effects on the body, what if we had a magic bullet? A way to target the staph directly without causing collateral damage. And that's what GladSkin represents to me. When I first learned about it, I thought it was science fiction. It turns out that it is actually science fact. Using endolysin is an incredible possible way to treat this staph overgrowth and restore balance to the microbiome. And I'm incredibly excited to see where this goes.